Hello, Beth. Can you hear me? Yeah, you can hear me? Can you see me? Okay, high five. You can't see me? Can you see me? No? High five anyway. All right. Well, you guys ready? Uh-oh, we lost something. Are we good? Okay, good. All right. We're going to start out today first by recognizing that this is the 30th anniversary of the Americans with Disabilities Act. And I have with me here Catherine Gresseth, who is the ADA brand ambassador for the Rocky Mountain region and executive director for Workforce Diversity Network of the Black Hills. And I'm going to read an executive proclamation first. Whereas the Americans with Disabilities Act, or ADA, was passed on July 26, 1990, to ensure the civil rights of citizens with disabilities, and whereas Rapid City, South Dakota affirms the principles of equality and inclusion for persons with disabilities as set forth for the state of South Dakota and as embodied in the ADA, the laws of the state of South Dakota, and ordinances of the city of Rapid City. And whereas the ADA prohibits discrimination against individuals with disabilities in public accommodations, employment, transportation, state and local government services, commercial facilities, and telecommunications. And whereas through the dedicated and tireless efforts of officials, organizations, and advocates, many strides have been made, and work continues in breaking down the physical and attitudinal barriers that have challenged people with disabilities. And whereas numerous organizations in Rapid City work with constituents to bring forth the promise of hope and freedom envisioned by the passage of the ADA, and whereas the City of Rapid City continues its commitment to ADA compliance and accessibility with improvements to public facilities, providing increased quality of life experiences in the community for people with disabilities, and supporting the continued work and awareness efforts of the Mayor's Committee of People with Disabilities. And whereas July 26, 2020 celebrates the 30th anniversary of the Americans with Disabilities Act, now therefore I, Steve Allender, Mayor of the City of Rapid City, South Dakota, do hereby proclaim July 26, 2020 as Americans with Disabilities Act Awareness Day in the City of Rapid City. So now I'll turn it over to Catherine for some words.
Thank you, Mayor. He also forgot to mention that I'm on his committee for the Mayor's Committee for People with Disability and the past chair. Rapid City has come a long way in the last 6 years, making accommodations and upgrades throughout the city to help people with disabilities. But what we all need to realize, just with age comes disability, so at some point, all of those things we're going to be able to use. We were just mentioning about the different technology that's come from the disability world. Texting came from the deaf world. Siri came out of the blind world. And those are all things that we all use every day. So when we think about the improvements that have been made throughout the city, we will be using all of those at some point in our life, because this is one group that we all will become a member of with time and with age, and also with an accident. 90% of disabilities come from an illness or an accident. Only 5% are born with that disability. So it will affect all of us. The mayor has done a great job. One of the things that the Mayor's Committee came out of from Thor last year was the meters in the disability spots were too high for someone in a chair to be able to put money in. So they lowered all the meters this past year, which was huge and so helpful to so many people that or give them their freedom and their ability to pursue happiness, and that's what it's all about, reaching our full potential. And of course, driving is one of those things that sometimes we take for granted. And people with chairs, so many are able to drive. In Thor's example, he has a van that he is self-driving. So again, we want to thank the city for all of the things that they've done over the past few years, and excited to see the Civic Center and all that it will have to offer as we continue to grow as a community. So thank you, Mayor Allender, for all that you've been doing.
Okay. July 22nd. I heard the cicadas for the first day today. Means we're halfway to the end of summer. It's one of the worst times for me to start hearing those loud bugs. Consensus from cities around the hills are that there are many visitors in our area. There are reports of traffic jams in small towns, and campgrounds, of course, full. And a lot of people here in the area vacationing, many out-of-state plates. There's also indications that this year's Sturgis Motorcycle Rally will be no less than a normal-sized rally. In fact, the early indications would suggest that it may even be bigger. But that still seems counterintuitive to me. But I'll tell you the week after the rally how many people showed up, because that's when we'll know for sure. So proactive measures should be taken in public spaces when our towns across the region get more crowded, and when those businesses that you're entering are more crowded. Some of the businesses now are imposing face covering rules within their store. I think this is, realistically, it's a positive step. It's not universally accepted. In fact, there are some reports of people going into stores like Walmart, and once they get past the greeter, then they will slip the mask back off. So this is a community crisis that we've been in for the last several months, and it's going to take a community solution to get through it. But unfortunately, I think we've chosen instead to be divided on it and to fight about it. 1 week ago today, the Department of Health reported 25 new COVID-19 cases in Pennington County. That was the second largest one-day total for Pennington County so far. During this press conference, I reassured you not to put too much emphasis on that one number. I downplayed the significance of that one-day total as to suggest more data would be needed to draw any conclusion. Well, that data existed, but I didn't have access to it. The day after the 25 new cases, there were 5 more. And on that day, it was reported to the media that an outbreak had occurred at a local nursing home in Rapid City. The following day, 25 more cases were reported. In the days to follow, there were 9, 7, 5, and then another 25. 101 new cases in a week, with at least 56 of them recorded at one location. Keeping in mind also that it takes several days to get a positive test result. I was disappointed with the lack of communication from the Department of Health, so I sent a message to them. I expressed my disappointment, and I asked if there was any way or any intent to communicate better with cities and counties. In their reply, they offered me the phone number to the local nursing home so that I could contact them, and also reminded me that there are currently twice per week press conferences from the governor's office. I should state that we've stopped getting notices for those governor press conferences some time ago. I then contacted the city of Sioux Falls. I asked during their many outbreaks if they had ever received direct communication from the Department of Health. They reported that they had only received information from either the media or the grapevine. So the point I'm making is that if the state cannot or will not communicate with cities so that we can better communicate with you, then what possible good can come from press conferences like this one? In the beginning of the pandemic, I think it's fair to say we all felt differently than we do today. There was a lot more unknown back then. And we had daily press conferences, and then we went down to a few times a week, and then once a week. That information was very much appreciated, and most of us who were relaying information were relaying only what we had learned and passing it on. There was a thirst for that communication early on. Our audience for this type of press conferences dwindled, although we do have several stations reporting it, live streaming it. But I've just got to come to the conclusion that I am likely providing delayed or inaccurate information, and I don't believe that can be justified. And it is primarily because I don't have access to timely and relevant information from the state. And it looks as though we never will. I believe it's necessary to defer communication to the state on matters of COVID-19, and accordingly, I plan to suspend these weekly press conferences and will schedule future press conferences as needed as the situation develops. But admittedly, in the past 6 or 8 weeks, there have been a lot of status quo for the pandemic. Reporting of a handful of cases and some talk about hospitalizations and safety practices. And I think and I trust the community has been adequately advised on the precautions that should be taken. And I don't think me getting up here once a week and repeating all of that is doing much good. So having said that, I'll ask anyone in the room if you have any questions.
Dave Kidd, News Center 1. Has there been any explanation from the state on what the breakdown of communication is, like what the reason behind it?
No. I think the expectation for that communication is only on our part. I don't believe there's the same expectation of communication on the part of the Department of Health. So something we're wishing for and something they're not providing. And you know, it's not the first time we've spoken to them about communication. It's not the first conversation we've had with them, and they're holding the line. It just seems futile at this point to wish for more.
What's the concern as mayor from this lack of communication?
Well, I think, you know, let's say, for example, and I'm filling in the blanks here, but let's say at the time of testing, several nursing home residents and employees were tested, presumably some because there was an illness or reason to believe there was illness. Had we received information that mass testing had gone on in one building in Rapid City, I think there would be a responsibility to report that that type of testing was going on so that friends and neighbors and relatives and all those concerned could be advised. Now, I don't know how people would act differently if they knew this, but perhaps if your next door neighbor was a caregiver at this particular organization, you may at least be able to understand why they're indoors or understand why you may not want to go to their house and pound on the door. In a situation like this, I think communication is obviously important for the transferring of factual information from one to the other. That's obvious, should be obvious. But the thing in public service, I think, that is more important or just as important is the ability to inform your constituency so that they keep confidence that you're not hiding something. So that they keep confidence that if there's something they need to know, you're going to be the one to tell them. That's something that I have taken very seriously and very personally over the past 20 years of my public service. 5 years as mayor and the previous several years as police chief and as a police officer. Because our currency in public service, how we measure our success, in my opinion, is by that level of confidence. And the opportunity we have to gain confidence is through open and honest exchange of information. We certainly can't do it by the efficiency of our operations. I mean, government service is where efficiency goes to die. We have to fight that every day, and there are examples of how the system in government gets clunky and clogged up. Everything that won't work in the private sector is switched over to the public sector, and so this can be justifiably frustrating for people. But the one thing we have control over is how much we are willing to communicate, how much we're willing to loop in the people who are paying our wages forcefully, who are forced to pay our wages. I think that's a very important component of public service. So that's why my disappointment. Now, you might poll a dozen mayors across the state, and some of them may not have any issue with this. But I do, because of the way I see public service and because of my unique experience. Any other questions? Okay. Well, thank you all for attending.